Sexual dysfunction actually is defined as a disturbance of the normal sexual response cycle or as pain within the sexual intercourse. This issue causes distress for both partners of the sexual cycle, and the sexual dysfunctions can be symptomatic of certain biological disturbances, biogenic disturbances, or it could be a manifestation of intra-psychic conflict, or sometimes it could be a manifestation of interpersonal difficulties between partners.
Sexual dysfunction, definition of sexual dysfunction, impairment of sexual response cycle as desire, as arousal, as orgasm, and may lead to pain in vagina, pain after or during intercourse.
Sexual dysfunctions are defined as persistent as well as stable pattern of impairment in the normal sexual interest or desire. So if we have impairment in the normal sexual desires of clients, we usually put the diagnosis of sexual dysfunctions.
Well, the prevalence of sexual dysfunction, actually it's unclear because there is no studies that make a wild epidemiological research about patients who are suffering from different types of sexual dysfunctions. But we can say that 75% of men report always ejaculation or ejaculating during sexual activity. Less than 1% of men will complain of problem with reaching ejaculation that lasts more than 6 months. And this is very important results, by the way, concerning the prevalence of sexual dysfunctions. We can note that a lot of people, especially in young age, perhaps in early adulthood, between the age of 25 years old and 31 or 32 years old, suffering from early ejaculation. Another important thing concerning the sexual functions and the epidemiological concerning the sexual functional disorder, we can find that through the cross cultures, this percentage it's much more common through the cross cultures studies.
Actually, it is present in all cultures. Such kind of disturbances are present in all cultures, and we usually receive clients from all kind of ethnic backgrounds complaining of such kind of sexual difficulties.
Physical causes. Many physical or medical conditions can cause problems with sexual function. These conditions include diabetes, heart and vascular disease, neurological disorders, hormonal imbalances, chronic diseases such as kidney or liver failure, and alcoholism and drug abuse. In addition, the side effects of some medications, including some antidepressant drugs, can affect sexual function. Psychological causes. These include work-related stress and anxiety, concern about sexual performance, marital or relationship problems, depression, feelings of guilt, and the effects of a past sexual trauma.
Sexual dysfunction are highly prevalent and most commonly in female, affecting about 43% in women and 31% in male. The most common disorder in male is premature ejaculation, and the most common symptom or disorder of sexual disorder in female is hypoactive desire.
Sexual disorders not only sexual dysfunction, but also the sexual deviations are very important psychiatric disorder. The patient may feel shy not to talk about it for the psychiatrist and the patient, who should mention for his treating psychiatrist or even physician sometimes what he's suffering from. Sometimes the patient feel that he is abnormal, but he's enjoying the abnormality or the deviation. I'm discussing the deviation. What's the deviation? Some patients will have homosexuality feeling, lesbian form of relationship. Some of them have thinking or sexual fantasies, which is very abnormal one. Okay, for that reason, the enjoyment of that patient in sexual contact to these imaginations, but he can't do these imaginations, he can't do these acts. For that reason, he's not sexually fulfilled or satisfied. Then, what to do? Specifying these deviations, what's really normal, what's abnormal, what's the freedom of the society and the religion the patient is following, allowing him is very important to be understood. Then after that, how to adjust these deviations and to how to treat it is another story.
Well, differential diagnosis about sexual dysfunction is related to another medical condition from a side and substance medication which induce sexual dysfunction from another side, and also from the dysfunction about the orgasm or with orgasm from another side. So we have to make a difference between this pattern of three psychological disorder or three sexual dysfunctional, especially the dysfunction with orgasm in comparison with the sexual dysfunctional.
Causes of sexual disorder, whatever about the type of sexual disorder, premature, orgasm, pain or arousal, erectile dysfunction, may be classified into hormonal, psychological, or organic, or social. Hormonal may be impairment in pituitary, or maybe impairment in thyroid function leads to increase or decrease, may lead to desire, may be hypo or hyper, and increase prolactin level in the blood, maybe increase hypoactive desire, especially in men or women, and decreased testosterone hormones may lead to erectile dysfunction and else. Psychological problems can be psychological problems as depressive or anxiety, and family problems and job problems. We can differentiate from psychological problems and organic problem, especially in erectile dysfunction, the morning erection. The morning erection is the most prominent and the most prominent feature can be differentiated from psychogenic or organic erectile dysfunction.
For the comorbidities, neurotic illnesses, all type of neurotic illnesses, major depressive disorder, generalized anxiety disorder, other type of anxieties, and other type of depressive illnesses actually should always be ruled out when we speak about disorders of sexual dysfunctions.
Sexual dysfunction can affect any age, although it's more common in the 40 to 65-year-old range and is often related to a decline in health associated with aging. What are the symptoms of sexual dysfunction? Inability to achieve or maintain an erection suitable for intercourse. Inability to achieve or maintain an erection suitable for intercourse. Absent or delayed ejaculation despite adequate sexual stimulation. Inability to control the timing of ejaculation. In women, lack of interest in or desire for sex. Inability to achieve orgasm. Inadequate vaginal lubrication before and during intercourse. Inability to relax the vaginal muscles enough to allow intercourse. In men and women, lack of interest in or desire for sex.
For the gender-related diagnostic issue, actually, such kind of conditions are slightly more common in females. There is certain type of sexual dysfunctions that is specific to males. Other type of sexual dysfunctions are specific to females. And we have common type of sexual dysfunctions that are common for both males and females.
Sexual dysfunctions, it's related to some sort of dysfunctional in sexual tendency or sexual performance. We can find some sort of this sexual dysfunction such as premature ejaculation, and this pattern of dysfunctional or sexual dysfunctional related to males. Another thing, that over sexual desire. Over sexual desire, it means that the person has a very arousal sexual desire, a very arousal sexual tendency. In addition to obsessive sexual thoughts, we can find that the patient who has over sexual desire has over sexual thoughts. He need most of the time to start to see some pornographic and started to enhance himself sexually and started to exciting himself by himself. Another type of sexual dysfunctional, what we call poor sexual desire. And this is kind of sexual dysfunctional. We can find most common in females more than males. And this is most of the sexual dysfunctional disorders.
The relationship with other diagnoses, actually such kind of sexual dysfunctions should not be accounted by another mental disorder and should not be actually be due to the direct effect of certain substances. And also it should not be due to the direct effect of certain general medical conditions.
Signs and symptoms of sexual dysfunction according to the disorder, as in premature ejaculation. Premature ejaculation means premature ejaculation or ejaculation from the penis before intercourse or within in 2 minutes in intercourse or not he wash it. And symptoms of orgasm, anorgasm or loss of orgasm, so whatever in male or female, erection, loss of erection, male erectile dysfunction, and decreased arousal, a sexual disorder, and symptoms as hypoactive desire or hyperactive desires, whatever in man or woman.
For the functional consequences of sexual disorders, actually it's as we said, it's persistent instability to participate in the preferred sexual relationship, and this issue actually cause the difficulties for partners, sexual partners, and such difficulties may develop sometimes for example, depressive illnesses or other type actually of anxieties, and it could cause some kinds of marital discord because of such kind of dysfunctions.
Lifelong delayed ejaculation begins with early sexual experience and continues so our life. We can find by the definition that people may suffering from delayed ejaculation after the normal sexual activity or normal sexual function process. And this is normal, by the way. We cannot say that this is induced some sort of sexual dysfunctional, especially if it is after the sexual functions or sexual activity immediately. Another important thing that there is minimal evidence concerning the course of appropriate sexual desire. The appropriate sexual desire may occur in early adulthood phase in comparison with the age after 59 years old, so that the prevalence of delayed ejaculation appears to remain consistent until around 50 years old. And this is very important thing about the development and course concerning developmental of sexual dysfunction.
Regarding the associated features supporting the diagnosis, there should be inability to perform in the preferred sexual desire in all type of occasions, and such impairment should always be due in at least or present for at least 6 months, and such impairment should not be due to the effect of certain substances and should not be accounted for by another mental disorder.
Well, let's we focus together about the main functional consequence, or let's we imagine what is the main functional consequence in patient who suffering from delayed of ejaculation or even early ejaculation during the sexual process or sexual activity. He may suffering from a severe psychological distress during his life, especially with his partner. He may also suffering from extreme mood swing, and the patient cannot expect that he suffering from this pattern of disease or illness, so that he start to make a denial to himself. Perhaps we found a lot of patients who suffering from delayed ejaculation or even early ejaculation started to be aggressive with their partner, and this is result refers to that there is an issue and there is a problem which needs intervention, therapeutically intervention.
For this condition, actually, the impairment should be acquired or lifelong. It could be generalized or it could be situational, sexual dysfunction in certain situations, or the disturbance could be generalized in all type of situations. And such issue actually cause the impairment and cause clients usually to come for clinical attention, because this cause marked impairment between the sexual partners. For the differential diagnosis of sexual dysfunctions, all type of illnesses should be ruled out. All type of biological illnesses actually, which may cause sexual dysfunctions, as well as other major psychiatric classifications, should always be ruled out.
For the couple who wants to begin enjoying their sexual relationship, it's well worth the time and effort to work with a trained professional. Behavioral treatments. These involve various techniques, including insights into harmful behaviors in the relationship, or techniques such as a self-stimulation for treatment of problems with arousal or orgasm. Psychotherapy. Therapy with a trained counselor can help a person address sexual trauma from the past, feelings of anxiety, fear or guilt, and poor body image, all of which may have an impact on current sexual function. Education and communication. Education about sex and sexual behaviors and responses may help an individual overcome his or her anxieties about sexual function. Open dialogue with your partner about your needs and concerns also helps to overcome many barriers to a healthy sex life. Can sexual dysfunction be cured? The success of treatment for sexual dysfunction depends on the underlying cause of the problem. The outlook is good for dysfunction that is related to a treatable or reversible physical condition. Mild dysfunction that is related to stress, fear, or anxiety often can be successfully treated with counseling, education, and improved communication between partners.
behavioral modification programs for the sexual dysfunction, it was the main ways of the treatment. But recent days, the drug treatment is the main treatment. Premature ejaculation is very easy to be treated by single tablet per day. Impotence, so easy by using these new medications, Cialis, Viagra, etc. And no fear of these medications because people use it and reuse it again and feel that it's so effective and no side effects. The issue of sexual dysfunction, not only that one, but even sexual deviations, the behavioral modification is the most important. No specific drug treatment for sexual deviations like the sexual dysfunction. I mean for the homosexuality, lesbian feeling, etc., etc. No specific drug treatment, but there is a specific behavioral program modification. If the patient with homosexuality or lesbian feeling having other psychiatric disorders, maybe the role of drug treatment in that patient could be considered. Society and culture give a lot of pressure on the patient, on the family, even on the psychiatrist who's treating sexual dysfunctions and deviations. Then, knowing what's the normal versus abnormal in the religion of that society, in the definition of people with wisdom in that society is very important. Educating the society about this normal, which the real normal, not the public understanding, is very important to prepare the ground for understanding of psychiatric disorder is very important. A lot of beliefs about sexual disorders and way of treatment also by the public. For you should consult your psychiatrist, your physician, even a religious figure. You should consult who you believe in his way of thinking. Then look for these ideas together, and if you find it all going together, go ahead and don't think about anything else. If it's looking for you as contradicting each other's, consult them again and tell them about your fear about this contradiction. If it could be solved, or maybe your understanding for their consultation to you, it was the problem.